So what's going on? This is a dog skull, and this is kind of an example of what's going on. So what she's got going on, it's this joint here, the temporomandibular joint. Normally that's the joint that allows the jaw to move. And this joint has had some significant trauma. Because of that, because of the trauma, there's been a lot of buildup of bone there that is preventing this joint from moving beyond a couple centimeters probably. When that happened, there were multiple other bones that were fractured. This bone up here was fractured, so this coronoid process up here was fractured. There was damage to the zygomatic arch, and those are things that, so this whole area was damaged. There may or may not be some scar tissue in that area, and the concern about that is if we remove this joint, the procedure that she needs to have to kind of free up her jaw is to actually have this entire joint, this piece of bone removed here, and then what happens is just connective tissue that's connecting this part here to this part up here.
Okay.
The problem that we will face, and we can't know ahead of time, is if there is significant scar tissue going from here to here, and we can't see that on CT, we can't feel that on palpation, then there's a possibility that there may still be some soft tissue that's hindering her jaw from opening. So that's a decision that has to be made during surgery.
Okay.
One of the other things that will happen sometimes is if they have a shift of the bones, what can happen is that bone can, when the jaw opens, can get caught on this bone here and can actually lock their jaw in the open position.
Oh, okay.
Right now, based on what I'm seeing on the x-rays, it looks like this bone is fitting really well into this one. However, if we find that there's some locking that happens in the future, and we may not know that right away, we may not know it for 6 months to a year if that's going to happen, maybe even longer, then in some cases this bone has to be removed as well. If this bone has to be removed, then that's fine, it's not a big deal.
Would it be smarter to just take it out?
During the surgery, so what would happen during surgery? After this condyle is removed, after this bone is removed and that impedance is gone, then what happens is whoever does the surgery will check the jaw. Now, if they still can't open it, if that jaw still won't open, then there is one of a couple things that's causing that. And one is the possibility that there's scar tissue there. The other possibility, which I don't think is going on, is that there could be some fibrosis or scarring in the muscles themselves. So it is possible that some additional tissue may need to be released. And again, nobody's going to know that until they actually go in for surgery.
Right.
The sincere hope is that once we get this taken care of, that we'll have good jaw motion. We may not have really wide opening jaw motion, but if she goes from where she's at currently, is she can open up about like that. That's as far as she can. If when this is removed, if she can open up like that, that is still going to be adequate. If she can get that far and there's scar tissue, then it is likely that the scar tissue will be able to break down over time and more movement.
If she can open that far, that will improve her quality of life.
If she can open that far, that will improve her quality of life. Now, the other things that are going on, other than the jaw, and actually, one other thing that's going on is she also had a fracture right here, right where the two sides of the jaw meet.
Okay.
So that was damaged, and when that scarred in and healed, it didn't heal properly. It's kind of offset. And that has kind of changed the position of her teeth. If you look at her from the front, her jaw is just a little bit offset to the right.
Right.
And there are multiple things that are doing that. The fractures are part of that, and part of it is that this has shifted. And what that is doing is a couple things. My skull has no tooth here, but the tooth here is fitting into this space like it should. But on this side, what's going on? This lower canine tooth has been shifted over and is hitting right here.
Okay.
So it's not fitting up in between that space there, it's hitting the tissues there.
Okay.
And that is one of the things that is potentially causing problems. It is very likely that what that has done has created a hole in the roof of her mouth that is causing some communication between the mouth and the nose. So that is something that's called an oronasal fistula. So that is something that may be a factor.
Okay.
So that tooth is causing damage because the jaw has been shifted over slightly. So on the roof of the mouth, what's going on? she has multiple fractures of the bones of the roof of her mouth and these bones back here. And there are a number of these bones that have kind of shifted position. Some of them have kind of healed into a new position, and I have to re-look at the CT scan, but it looks like there is a part of this bone here that has been pushed up into her nasal passage and is just sitting up in her nasal passage.
Man.
It is very possible that that piece of bone is dead and is causing chronic inflammation in the nasal passages. The other thing is the roof of the mouth is normally a hard, solid surface. Mm-hmm. A lot of these bones are just missing. They're just totally gone. So there are a number of areas of the roof of her mouth where she just has soft tissue over nothing. My big concern, and what I was trying to look at with her mouth, trying to look in there with a light to be able to see if I could see the roof of her mouth, my big concern is that she also potentially has something called a cleft palate. A cleft palate is an opening, small or large or anywhere in between the mouth and the nasal cavity. Mm-hmm. That is much more likely to be causing her chronic nasal problems. Her inability to open her mouth may be some factor in her nasal problems, because what's happening is when she's eating, if she's not swallowing appropriately, when she breathes out, some of that may be getting shoved up into the nasal passages, and that will cause some irritation.
Yeah.
However, she also has at least one bone that's up in there, and she may very well have holes in the roof of her mouth that when she does get food in her mouth, that some of that food is chronically going up into the nasal passages.
Yeah.
And I say chronically because she has long-standing inflammation in those nasal passages, and a lot of her nasal turbinates, which are the small fine bones in the nasal cavity that the mucosa sits on, a lot of them are just gone. Mm-hmm. So she's missing a lot of those. A lot of these bones are shifted, so her whole facial dimensions have changed a little bit. It's not bad. It's not bad enough that it's causing significant problems. The main thing I'm seeing from the shift of the bones is that lower canine that's hitting the roof of the mouth and is probably causing some problems. Mm-hmm. So one of the things to be aware of is if she has damage to the palate, as far as the soft tissues of the palate, regardless of what's going on with the bone, and she's got communication there, even if we get her to open her mouth, she's still going to have these chronic respiratory problems. She's going to be at risk for developing secondary pneumonia and have other issues there. So there may be more work to do. Unfortunately, I can't see this area. I was hoping to be able to see. Mm-hmm. What I do see looks like it's intact, but when her mouth opens up, we may find a very different story.
Right.
And palatal tissue can be very difficult, so she may need some palatal reconstruction later on as well. And I can send you the pictures that I took too that can show you, but her on the right side here, her lower canine is right there, not causing any issues. There's a little bit of asymmetry. See how this side here is a little bit higher than this side? Uh-huh. And see this lower canine? See how that lower canine, instead of being on the outside here, see how it's hitting the roof of the mouth?
Yeah.
So that's what's going on there. And there is probably a hole right in that area that goes up to her nasal passage.
Okay.
She also has this area back here. She had a couple extractions back here, but she's got some irritation. Actually, that may be a suture. I thought that was a tooth root, but that's a suture. Yeah, I know, you're a very good girl. So we'll have to see what's going on with that palate. That's something that's a concern as well.
Okay.
So there's multiple things. Getting that condyle taken care of with TMJ is certainly, first and foremost, because we have to be able to open them out before anything else can be done.
Yeah.
Let me go through the CT scan results.
Good girl, baby girl. You want to come up? Come here. No, I'm not talking to you.